Hi, I would like to talk to you about the sugar values in blood. For that, I prepared on the board all the values that we're going to discuss today in order to explain what is the meaning of them. First of all, the blood sugar that we are having in our organism is going to be the glucose. There are other sugars that our body is going to use, but the one that is the most abundant is the glucose. So, what's the normal value for our glucose in blood? As you can see here, 80 milligrams per deciliter. This milligrams per deciliter is the unit that we are going to have to describe how much sugar we are having in our blood. But to give you an idea of how much it really is, these 80 milligrams per deciliter are going to be the equivalent of 0.8 grams per liter. But considering that the average amount of blood that we are having in our body is 5 liters, we are going to have a total of 4 grams of glucose circulating in our body as a constant. So this is the amount that in a normal healthy organism we are going to find. 4 grams in the whole blood circulation. 4 grams of sugar. So above this amount we are going to start having some risk for certain diseases and affections. We are going to discuss further details about it now. So when we go above 80 and cross the line going above 100, we are going to be considering that the person is in the condition of pre-diabetes. And when the values in sugar blood are going above 124, we are going to recognize that this person is crossing the line into diabetes directly. But as you may know, these values may change along the day depending on the activities, and even for a diabetic person which is diagnosed with diabetes, the blood sugar is not necessarily staying around 124. It can go above 140, it can go above 150, 60, even 200. So I will give you an explanation of some little things that happen that are very important when a person is reaching these levels. For example, here I'm marking 160, which is the double of normal value, and when the blood sugar is reaching 160 milligrams per deciliter, there is going to be a cancellation of the normal functioning of the immune system. So, in other words, when the blood sugar is rising above 160, the capacity of your immune system to respond over an infection or over the invasion of a pathogenic, let's say a bacteria or a virus, is going to be really affected. And even though our body is trying to keep these sugar levels in order, the constant of this sugar raising is going to affect the immunity against microorganisms that may try to invade our system. How about, let's say that the blood sugar is rising above 180. The sugar is really important for our body, but our system has a mechanism in which, when there are certain levels that are reached, in this case 180, the body is going to start getting rid of this excess of sugar through the urine. So let's say you are going through a difficult time in which you have raising in the blood sugar, and is sustained for 2 or 3 hours, and is going above 180. If you are going to the toilet, you will probably have in the urine the release of this excess of sugar. This is what is called in the medical terms, let's say, the renal threshold. So, looking back to what we were talking before, so above 160 we're going to have immunity loss or compromise, because it's not going to cancel the whole functioning of our immune system, but the response to the alert against any microorganism is going to be really affected. And if it's going above 180, it's going to be called renal threshold. Why is it important? When our blood gets filtered to be separated from the components that are not needed anymore, this filtration is produced in the urine, and through this filtration, normally the glucose is going to go into the urine, but later is going to be retaken back into the organism, back into the bloodstream. So when you're reaching 180, this mechanism of glucose or sugar retake is going to be cancelled, and this is the reason why you find sugar in the urine, because normally what you're having in the urine are some excess of salts, water, and some other substances, but not sugar or other components like protein, for example.